My name is Daelor Osen. I'm a second year resident in the emergency department. I did a case study with fellow residents, attendings, and a student covering purple urine bag syndrome. Jessica Blaylock, Dr. Michael Bloss, Dr. Taylor Bloss, Dr. Jennifer Briggs, and Dr. Anastasia Fisher all contributed. Purple urine bag syndrome is a complication of urinary tract infections where catheter bags and tubing can turn purple. It's usually noted with no significant change in symptoms, but is usually accompanied with a UTI. It's generally benign, but can be alarming for patients to see. King George III was reported to have this during a time of constipation, but there has been no formal research into this until about 1978. The most common risk factors associated with this are advanced age, female gender, constipation, dementia, being bedridden, institutionalization, end-stage renal disease, dehydration, chronic catheterization, use of PVC urinary catheter bag, recurrent UTIs, and high urinary bacterial counts with alkaline urine. The most important of these factors is long-term catheterization, being female, chronic constipation, elderly, being bedridden, or institutionalized. Purple urine bag syndrome is a rare phenomenon that is poorly described in the general population. In patients with the risk factors noted above, the prevalence is noted to be as high as 42%. Mortality is generally related to the patient's comorbidities and not a direct consequence of purple urine bag syndrome. Generally, the longer the PVC bag is used in a patient, the deeper the shade of purple the bag becomes, despite changing the bag and different companies being used in terms of the catheter bag. Mechanism of action is a consequence of different bacterial metabolic products being broken down and metabolized. Ultimately, the flora of the GI tract and urinary tract converts different metabolites into endoxyl, and from there it's secreted into the urine where sulfates and phosphatates are produced by certain bacteria. This converts it to endoxyl, and then in alkaline urine, it is further converted and oxidized into indigo and indirubin pigments, which give the purple pigmentation of the urine. The bacteria is primarily gram-negative, but most studies have found that it's generally a polymicrobial situation. A lot of times patients will have renal failure and cause problems with clearance of endoxyl sulfate, and also patients with constipation, intussusception, or ileal diversion will likely have more bacterial growth secondary to urinary retention. We did a case study on a 74-year-old female that presented to the emergency department with a past medical history of diabetes, hypothyroidism, chronic anemia, hypertension, and end-stage renal disease requiring dialysis. She had presented from her nephrologist for concern of purple urine. She also had numerous comorbidities associated with the previous described case studies. She had chronic constipation and generalized weakness when she reported to the emergency department. CT of the abdomen pelvis was obtained as it was concerned for ureterovesicular fistula, but it revealed prominent fecal burden. She had a significant lab of white blood cell count of 16. A urinalysis was not able to be obtained as she needed a catheter replacement done by urology. She was empirically started on cefepime and admitted to the general medical floor. Her primary urine culture revealed Enterococcus bacteria, and she was transitioned to vancomycin while waiting speciation. Eventually, she was found to have vancomycin-resistant Enterococcus, and infectious disease was consulted where antibiotics were transitioned. Ultimately, they were stopped as infectious disease stated this was merely a consequence of her indwelling catheter. In summary, it can be a striking appearance of the urine, but there's no real recommendations for what's to be done for these patients. It can indicate, in relevance of it, it can indicate any predisposing factors being more important to treat. And the study was limited as there's no additional studies in the United States, and most studies are elsewhere.